Good evening. My name is Misty Peak, and tonight I will be discussing the disorder ADHD in our children today. Did you know attention deficit hyperactivity disorder, also known as ADHD, is one of the most common childhood disorders and can continue through your adolescent life? That is just one of the fun facts you will learn in today's lesson. We will be discussing the disorder ADHD, the cause, signs and symptoms, who is at risk, treatments to help you function with the disorder, and everyday tips that help your child function with ADHD. Some need-to-know facts about ADHD are as follows. ADHD is defined as a problem of not being able to focus, being overactive, not being able to control behavior, or a combination of these. For these problems to be diagnosed as ADHD, they must be out of the normal range for a person's age and development. ADHD is separated into 3 different subtypes: predominantly hyperactive impulsive, predominantly inattentive, and a combination of hyperactive impulsive and attentive. Causes of ADHD are known, but studies suggest genes play a large role. They are currently researching if environmental factors, brain injuries, nutrition, and the social environment have any contribution to ADHD. The signs or symptoms of ADHD are inattention, hyperactivity, and impulsivity. Although these behaviors are normal for most children, in an ADHD child, these behaviors are to a greater extreme and happen more frequently than a typical child. Diagnosis of ADHD is done when a child has had these symptoms for greater than 6 months and to a degree that is greater than other children of the same age. Signs and symptoms of ADHD usually appear between age 3 and 6, and average onset is at age 7. Treatments for ADHD are mostly focused on improving your daily function and reducing your symptoms of ADHD. Current treatments for ADHD include medication, various types of psychotherapy, education or training, diet, or a combination of these treatments. ADHD symptoms can be relieved by these treatments, help you do well in school, and help you to lead a productive life, but will not cure your disorder. Researchers are trying to find new and more effective tools to help better understand ADHD and to find more effective ways to treat and prevent it. Some friendly tips to help your child live with their diagnosis of ADHD are as follows. Make a schedule. Organize everyday items. Use homework and notebook organizers. And when speaking to your child with ADHD, be clear and consistent. And when they follow the rules, make sure to give them praise and rewards. These facts are just some of the facts we will be getting into more detail about today. To gather this information, I have researched online mental health documents and am also currently the mother to a child with ADHD, which has caused me to research information and to speak to many specialists that include neurologists, behavioral specialists, counselors, therapists, pediatricians, and dietitians that have helped me learn how to help my son live a productive and normal life despite his disorder. Now, from the knowledge I've learned, I am going to inform you on what ADHD is, inform you the cause of ADHD, what the signs and symptoms of ADHD are, who is at risk for ADHD, what the current treatment options for ADHD are, and then give you some tips on helping your child with ADHD live a productive life. First, let me discuss what ADHD is. ADHD is a disorder also known as attention deficit hyperactivity disorder. It can begin in childhood and continue throughout your adolescence and onto your adult life. ADHD is known to be the most common disorder in children. It is separated into 3 different subtypes: predominantly hyperactive impulsive, predominantly inattentive, and combined hyperactive impulse and inattentive. Predominantly hyperactive impulsive is defined as a condition in which a child has an unusually high activity level, impulsivity in a short period span. Symptoms of this type of ADHD may include fidgeting or squirming in their seat, nonstop talking, running around, touching or playing with everything and anything, trouble sitting through events, constantly in motion, difficulty doing quiet tasks or activities, sleep complaints, being very impatient, blurts out inappropriate comments, shows emotion without restraint, acts without regard to consequences, and interrupts conversations or others' activities often. A child with this subtype of ADHD will have 6 or more traits from the hyperactivity and impulsivity categories and have less than 6 of the inattention category, but they might still be present to some degree. Predominantly inattentive is defined as having serious inattention problems, as they do cause any problems with others, but sit quiet and ignore others. Children with this subtype have low levels of cortisol and have 6 or more traits from the inattention category and less than 6 traits from the hyperactivity and impulsivity category. Symptoms of this subtype include being easily distracted, missing details, forgetting things, switches from one activity to another, difficulty focusing on one thing, becomes bored easily, organizing, learning something new, loses things, difficulty finishing work, doesn't listen when spoken to, daydreams, easily confused, moves slowly, difficulty processing information as quickly and accurately as others, and struggles to follow directions. Combined hyperactive impulse and inattentive is defined as the combination of hyperactive, impulsive, and inattentive with 6 or more traits from each category. Child with this subtype also has high levels of cortisol, and this is the most common type of ADHD. Now, as we have discussed what ADHD is, let us move on to what causes it. Researchers are uncertain of the cause for ADHD, but suggest genes play a large role, and that environmental factors, brain injuries, nutrition, and the social environment might contribute to the disorder. Current studies show that ADHD runs in families, so by studying their genes would help us to prevent ADHD from occurring or help us with more options for better treatments. Studies show that a certain gene that is carried causes thinner brain tissue in the area that is directly connected to attention. The level of thickness begins to be normal as a child who has a gene becomes older, and research showed their ADHD symptoms improved. Environmental factors have also researched and found to have a high risk for causing ADHD. Studies also show that when a fetus is subjected to alcohol consumption, cigarette smoking, drugs, and lead, they are at higher risk for developing the disorder. A small percentage of children who have obtained a brain injury showed they developed the disorder of ADHD, but might just show similar behaviors and not actually have the disorder. Nutrition in the foods you consume have been linked to ADHD. Artificial colors and preservatives are the leading additive consumed that may lead to ADHD. Now that you know some of the cause of ADHD, let's talk about the signs and symptoms. ADHD has 3 main behaviors demonstrated by a child with the disorder: inattention, hyperactivity, and impulsivity. They must demonstrate traits from these behaviors for at least 6 months and at a higher degree than other children in their age group. Symptoms of inattention may include being easily distracted, bored easily, forgetting things, difficulty focusing, unable to organize or complete tasks, losing things, unable to listen when spoken to, struggles following instructions, unable to process information as quickly and accurately as others, daydreams, is easily confused, and moves slowly. Symptoms of hyperactivity may include fidgeting and squirming in their chairs, non-stop talking, running around, playing with everything and anything, unable to sit through events, constantly moving, and difficulty doing quiet tasks and activities. Symptoms of impulsivity may include being impatient, blurting out inappropriate comments, shows emotions with restraint, activity without regard for consequences, and interrupting conversations or others' activities. Now that you know the signs and symptoms of ADHD, we will talk about who is at risk for developing the disorder. ADHD is known as one of the most common disorders in children that can be maintained and continue to show symptoms throughout your adult life. Average onset is age 7, affects in 1 year an average of 4.1% of Americans 18 and older, 9% of American children 13 to 18 are affected. Girls are less likely to obtain the disorder than boys, who obtain ADHD 4 times more than girls. Fetuses subjected to alcohol, smoking, drugs, or lead are at risk to obtain the ADHD. Symptoms usually begin at ages 3 to 7. Now that you know who is at risk for ADHD, we will discuss possible treatments for the disorder. Treatments of ADHD do not cure the disorder. They help to lessen the symptoms and improve your function in day-to-day life. Treatments include medication, various types of psychotherapy, education, training, diet, or a combination of these. Consuming medications to maintain your ADHD is the number one used treatment. Stimulants is the form most commonly used to reduce hyperactivity and impulsivity to help improve their ability to focus, work, learn, and improve physical coordination. Taking medications is a trial and error. One medication that may work for one child may not work for every child. Don't get frustrated when trying to find the one that works best for your child. Stimulants come in different forms, but the active ingredients is the same. They may be a pill form, a capsule, a liquid, or even a skin patch. The doctor and parent should work together to decide which form is best for the child and their day-to-day living. Stimulants can have side effects. Some may include decreased appetite, sleep problems, anxiety, irritability, mild stomach aches, and headaches are the most common side effects. Psychotherapy is also used on children with ADHD. The behavioral specialist is the main way psychotherapy is applied in children with this disorder. Psychotherapy helps children learn to organize tasks, completing schoolwork, being able to work through emotions, and teaching them to control their own behaviors. It teaches parents and teachers to give positive or negative feedbacks for certain behaviors. It teaches them to make clear rules, chore lists, and other structured routines. It also teaches social skills on sharing, being patient, and being able to read people's emotions so they can respond appropriately. Education and training is a key element to controlling ADHD. The more you know, the easier it will be to help control and maintain your child's ADHD symptoms. Now that you have been informed on the treatments of maintaining your child's ADHD symptoms, finally we will talk about some tips on helping you help your child live a normal, productive life with ADHD. There are many things that can be done to help your child with ADHD live with their disorder. Make schedules, organize, use homework and notebook organizers, be clear and consistent, and give them praise and rewards when rules are followed. Place a schedule where your child can see it, including all their daily activities, chores, playtime, and homework. Maintain their schedule, keep the same routine, and if changes need to be made, make them as early as possible. Be very organized and encourage your child to be the same by making sure everything has a place and that they place the items in their proper places at all times. For school, use homework and notebook organizers to ensure organization at school as well as at home. Encourage they bring home all supplies needed to complete homework assignments and that they write their assignments down in a planner prior to leaving school each day. Give child clear and consistent tasks, directions, and rules. They need to be able to understand what you are asking them to do. And it will consistently help them function in day-to-day life. ADHD children look for and expect criticism, so be on the lookout for not only bad behaviors but good behaviors, and reward them and give them praise when they make good choices and behave well. In conclusion, we have talked about ADHD as a whole, what it is, some of the possible causes, signs, and symptoms to look for, who is at risk, treatments, and tips on living with ADHD. If you would like more information on ADHD, I would recommend reading A Participant's Guide to Mental Health Clinical Research, clinicaltrials.gov, find NIH-funded studies currently recruiting participants with ADHD, and consult your pediatrician and/or behavioral specialist for questions concerning your child's possible ADHD symptoms. On that note, I would like to leave you with this last thought. ADHD is a disorder that affects a large majority of our children today. As parents, teachers, caregivers, and role models to the young people of the world, it is our responsibility to make ourselves familiar with this disorder so that we can understand and be better prepared to helping our children with this disorder live a normal, functional, and happy life. Thank you again for coming and giving me the opportunity and helping you better understand ADHD and how to help your child with it. Have a great night.